Hi, I'm Chelsea from Getting the Better of Endometriosis. I'm also a research assistant for Worldwide Endometriosis March. You're watching Red Flags in the Media. Endometriosis Awareness Month is coming up, and just in the past week alone, I've seen some red flags pop up. Let's talk about them. First off, Lexi Young from The Bachelor opened up about her personal experience with endometriosis. This is not a bash at her whatsoever. I'm not bashing her because the patient lacks the knowledge, usually because informed discussions are not happening. Patients usually are not given the right thing with the correct information. And the correct information usually comes with those informed discussions during those appointments. Oftentimes, if insurance doesn't approve whatever the doctor recommends, then the doctor has to push another treatment that's usually recommended by the insurance company, not what the doctor recommends. So we also have two tiers here that are pushing onto two different treatment styles for one individual patient. Outdated medical practices and medical theories are causing confusion amongst insurance adjusters, amongst the medical community, and amongst the patients themselves. It's also causing harm and just all around chaos. And that chaos is happening within the media when people become outspoken and they have the statements incorrect. There's no stage 5 endometriosis. Endometriosis is not the endometrium or the uterine lining. It's just similar, but there are far more differences. You also can't just take everything out and just be okay every single time. Most of the time, there is so much more to managing endometriosis than just removing it from the body surgically. We are on to number 2. We have Miss Amy Schumer speaking out on her endometriosis experiences, except she said that endometriosis was an autoimmune disease that women needed to look into. There's no clarification or evidence saying that endometriosis is autoimmune. It has been hypothesized to increase the risk for autoimmune diseases, which means that the inflammatory processes that are happening from endometriosis could basically influence the inflammatory nature associated with basically the autoimmune aspects. Now, again, all of that is still being investigated. There is no 100% guarantee on, yes, endometriosis is autoimmune. So, Amy Schumer's statement on that. Then we go into Good Morning America, reporting on Miss Amy Schumer's very public post. And then again, too many times does Good Morning America do this, discuss endometriosis as being the endometrium or misplaced uterine lining. They also follow up with Dr. Second, who continued to push retrograde menstruation as the theory for endometriosis, and also stating that all endometriosis begins when we look at Dr. Second is also founder of the Endometriosis Foundation of America, who also have a handful of celebrities advocating about endometriosis. For example, Amy Schumer. And then we also have good old Whoopi Goldberg, who caused a great stir in the endometriosis community with her red flags, associating antibiotics with the reason that she is now cured of endometriosis. There is a lot of lines here that Dr. Second has been involved in, and Endometriosis Foundation of America, that are really, we gotta watch it. These statements can lead into the discrimination that is happening in the medical field. Why? Because we're pushing a woman theory, a retrograde menstruation theory that continues on to give people this idea that, oh, it's a bad period, oh, it's just a woman's disease, oh. None of that is correct, and we have evidence that they are wrong, and they are continuing to harm a entire community of individuals that are supposed to be protected by the healthcare system, as well as the government. Alright, and then we have number 4, the continuation of holistic endometriosis coaches and herbal doctors claiming to resolve endometriosis naturally. The thing is holistic medicine and Western medicine seem to have like this thing in common that they can just touch the disease without actually touching the disease. Surgery, basically, is what I'm saying. That they don't think that you need surgery and you can do all these other steps to avoid surgery and avoid blah blah blah. Yes, that might be right. You can avoid having repeat surgeries and a bunch of surgeries, and a lot of that also stems with proper recognition in med schools, not by changing your diet or introducing diet changes. They begin this push on medications and the diet recommendations and then supplements, and then they sit there and they're like, oh, well, you didn't try hard enough. You need to maybe go along this route. You need to do this. You need to do that. Continue doing more because you're not doing enough. A person can do everything right and still suffer from pain. And I say that from experience. Just removing inflammatory factors in the body does not guarantee reduction of disease or reduction of growths. All it can possibly help and be beneficial for is management of those symptoms. Why? Because the disease is still present. The disease is still growing after and upon itself. Why? Because it stimulates itself with its own hormones, with its own nerves, with its own blood supply. There are so many layers to its own breakdown that we don't even realize when we're sitting here and we're throwing all of these statements out saying that we can resolve endometriosis and reverse endometriosis. Like, these are just the most ridiculous, absurd statements that can be said. Like, yes, you obviously are able to control symptoms if you reduce inflammatory responses to an inflammatory disease. That happens. But you're not treating the disease. You're just treating the responses that happen that stimulate actions from the disease. So keep this in mind. Of all that mumbo jumbo between Western medicine and holistic medicine, all of it is just symptom management. Nothing is actually getting to the root of the disease except for excision surgery. And as much as people hate the push upon excision surgery, we cannot deny the facts that it is the most beneficial way in treating the disease down to the root itself. And that's what I think people are not understanding, and I think that is one of the biggest factors that we also have to focus on as we go into Endometriosis Awareness Month, as well as those key factors on realizing that endometriosis is not the endometrium, and a lot of articles and media places and even studies that are coming out that discuss endometriosis as reproductive aged, uterus-based endometrium or mice implantation of endometrial tissues. All of those wordings are key in getting proper acknowledgement and movement within endometriosis research and overall change for the endometriosis community and what we deserve. So I want you guys to hopefully take some of what I said and dive into it as you move forward into Endometriosis Awareness Month, and remember those red flags when they do come across in the media and across social medias, research papers, etc., because they're out there and it's going to happen, and we're going to see it this month because it happens every month, and we're not to the point where everybody is at the same understanding of this disease. And it sucks because it's the people with the money and the people with the biggest push that are the root cause of the stagnant stasis that we are at currently. If you liked this video, I want you to catch the next video, which is going to be red flags in endometriosis research and trials. Catch you later.